Hello, everyone. It's Vasant Kainkaryam, physician and founder at Four Elements Direct Primary Care and Wellness Space right here in Connecticut. For those of you who don't know us, we are an affordable membership-based primary care practice. Tell people think of it like the old school doc from 70 years ago in a very modern Amazon Prime type of gym membership. So super excited. We like to do a lot of teaching and education. So we've started our discussion with the Doc VK series. And so today we're going to be talking about how to save money on medications using GoodRx. So many of you may have heard of GoodRx, and it's one of the tools out there. In full disclosure, I have no formal affiliation with them or any financial incentive. This is just to purely share how to use different platforms to save money. So if you used GoodRx before, you know that oftentimes using coupons or prescription memberships is cheaper than using your insurance. So first of all, just sort of understanding that insurance doesn't have to be used for medication all the time. We're going to use a platform today briefly to show an example of how to maximize the benefit with it. So I'm going to share my screen over here. And so we're going to go through this together. So we're going to search for a medication called rosuvastatin. So rosuvastatin is a generic of a medication called Crestor. It is used for high cholesterol. If someone has heart disease, oftentimes this medication is used. So when we first search for this medication, we're going to look, just as an example, 10 milligram tablet, and we're looking for 30 tablets. On the left, you get a list of all different places where you can potentially buy the medications, and on the right is the cost. Now, one thing that's interesting to note is that oftentimes we are wedded to a particular pharmacy. We ask our doctor, hey, say, you know what, this medication, here's my pharmacy, please send it there. If you want to maximize savings from medications, you cannot be fully fixed to a pharmacy, and you'll see why. So it's important, if you want to use something like GoodRx, is to shop for the lowest cost before you ask your doctor to send it to a pharmacy. So for example, let's look at this scenario, right? So Walmart, it's $15.41. Stop and Shop is $9.98. Big difference. Now let's go to Walgreens. And so if you look at Walgreens, $67.75, right? So now we're talking almost $50+ difference for the same medication, whether you get it in Walgreens or whether you get it in Stop and Shop. So what's really challenging is that pharmacy costs are so random at times, right? And so one thing says retail price $109, another thing says retail price is $54. And so it just doesn't make sense. And so part of this is beginning to understand that number one, different pharmacies have different costs. And number two, as a consumer, you may have historically been used to going to a particular pharmacy because your insurance is in network with them or whatever. But when you're using something like GoodRx, you are not using your insurance for it. So it doesn't matter which pharmacy you go to. So if you want to truly save money, you want to try to go to whichever place is going to give you the medication for cheaper. And so one thing what you're going to find interesting is, let's compare some of our traditional pharmacies like Walgreens. So Walgreens, $67. CVS, what do we got here? 18 to 21, right? So it's kind of varied. Let's go to ShopRite. We've got $9. Let's go to Big Y. We've got $10, right? So it is important to shop around and see what's going on. And what you will often find also is that grocery stores have a lower rate than traditional pharmacies, right? And because one of the incentives for grocery stores oftentimes is you come in there to buy medication, but then you also shop for your groceries at the same time, and that's how they make money. So, number one rule is to know where you want the medication to go after price shopping before you ask your doctor to send the prescription. Oftentimes with insurance, you may not know the cost until it has already been sent. And then if you happen to be by that window, let's say you went to a CVS or Walgreens or wherever, and you just happen to be by there, and you're like, oh, this cost seems a little high, just go on the app and you may at least be able to save a couple of bucks if you use the code. Number two, grocery stores oftentimes are cheaper than traditional pharmacies. So just keep that concept in mind. And number three, when they check you out, they're not going to be using your insurance. They're going to be using these codes. So you want to make sure that you have these codes with you, and you can either text it to yourself, email it to yourself, or print it, or there's a great app to download, and you would use that. So this is one really simple way of saving money on medications. And many, many times, using something like this is still going to be cheaper than using your health insurance. Now, the one thing to pay attention to is depending on what your health insurance is, the medications that you use through health insurance may apply toward your deductible and your out-of-pocket maximum. Using something like GoodRx will not. So if you tend to blow through your deductible and you reach your out-of-pocket maximum, this may not be the right scenario for you. But if you're a family, or if you have a family with a really high deductible and you barely meet your deductible, this is a great way of saving money. So this is just one option. As we go through these series, we're going to have one every week. We're going to talk about other ways to empower yourselves as consumers, and to learn how else you can save money in our super expensive healthcare system. If you want to learn more about what we do in our practice, check it out, www.4elementsmd.com. We work with a lot of our patients trying to help people get great care and save money at the same time. So thank you for watching, and we'll talk to you guys soon.